And we're joined now by NBC News contributor Dr. Joseph Fair. He studies viruses for a living, worked in Africa during the Ebola outbreak. Dr. Fair, good morning. I want to zero in on this issue about the masks. What is the data? What's the science behind this new requirement that we expect today from the CDC? Excuse me, not requirement, suggestion that Americans in hotspots wear some kind of facial covering.
This is really based on, 2 or 3 studies, both coming out of China, Iceland, and here in the U.S., that anywhere from 25 to 50% of infections would be what we call silent infections or asymptomatic. So the mask is not to protect yourself, because, we don't want people thinking it's going to keep you from getting infected, but it's to keep you, if you are asymptomatic and you're falling in that category of a silent infection, from transmitting it to others. So we know that that is a major cause for the explosion in cases that we're seeing here in the U.S. And so having a mask on physically keeps those droplets from coming out of your mouth and onto someone else. And I should emphasize, a mask does not mean that you shouldn't social distance, because if you're doing the proper social distancing, it's still not a problem. But we know not everybody's doing that. So if you wear the mask, that will physically keep others from getting the virus coming from, literally out of your mouth.
Yeah, might stop you from touching your face as well. But let's talk about what kind of mask. We can all agree, and it is worth saying, again, not those N95 professional grade masks that our healthcare professionals so badly need right now. Would any kind of face covering do? I mean, could you take a handkerchief and hold it over your face, or a bandana? I mean, if you're not handy with a sewing machine?
Absolutely. You can use anything that you can, get from your home. One of the more innovative ones that I saw was someone actually using a pair of underwear and, tying it around their head. But you can use handkerchiefs. You can use anything that you can tie around your face. It's not ideal to have something that wouldn't be on your face all the time, because, you're going to have to keep it up there a lot. And I should also emphasize, we're particularly emphasizing this in places like grocery stores, pharmacies, places where we have no choice to go, but where you are going to be in close proximity to others.
It's our understanding that the White House and the CDC are going to issue a guideline that it will apply to hotspots only, places where there is community spread, and that it won't be mandatory. Do you agree with that? Do you think it should not be mandatory?
No, I don't agree with it. To be honest, if we know that 25 to 50% of infections are silent or asymptomatic, I think just like a lockdown, there should be a nationwide mandate that we all start doing it. And again, we're getting this data after talking with China and other countries that had a lot more cases early on. And they showed they demonstrated that a lot of their cases were, they were able to lower their numbers by people actually wearing masks and not transmitting the virus to others.
All right, Dr. Fair, thank you so much. And I know you're going to be back in a few minutes to tell us about some other alarming new research on how this virus can be spread. We're learning so much, Hoda, as it all unfolds before our very eyes.